Welcome back. We're going to move a little bit further down on the trunk and start to talk about the low back pain. We're going to focus today on just central low back pain, and we'll discuss another day about the sides of the back and the legs and sciatica. But today we're going to talk about central low back pain. There can be central low back pain related to organs like your kidneys or other areas where you want to rule out and make sure that everything is working out with your organs, make sure everything is fine with your bowel and bladder, even your gut. All these areas can refer pain to your low back. Let's say everything else is cleared out and you're good and you visited your doctor and you have this low back pain. Well, one of the common reasons that we have the low back pain is those muscles in your back, the ones that go along the spine that we talked about for the mid back, there's some that go along the low back, they have learned to contract, and they contract, and they compress on the spine, and they don't know how to let go. We often hear about disc herniations or a slipped disc, a ruptured disc, or even pinched nerves in the low back. And those are issues of the low back that can contribute to inflammation. And often what happens is you've done an activity where you get one of those injuries. But over time, those injuries, they can stay there, but they've healed, but the low back pain persists. And what happens is when you have an injury, or maybe you're in a car accident, your muscles start to guard and they protect. They don't know how to let go because they haven't been taught how to let go. Especially if we're in this stand up tall, suck up your gut posture. As soon as you do that and you suck up your gut, you start to hinge off of your low back. This is something that I work with people in learning how to get their ribs in neutral so that their low back is not overcompensating all the time and tightening up. You can feel it whether you're standing or sitting. If you suck up and lift up your ribs, your low back tightens. Don't do this if you already have low back pain, but just imagine it, and you can watch as I do it, and you can see, I'll move my arm out of the way. As soon as I lift up my ribs and lift up my chest and pull my shoulders back, I start to hinge off of my low back. And those muscles learn how to pull, and over time, they start to pull on your joints and your bones, and they don't know how to let go. So, first things first is your rib cage in the correct position? Is it down? Is your sternum in? Do you feel your side abs kicking in to pull your ribs down? Those are hard skills to learn when you've been in a certain position for most of your life. I can help you. You can watch some of the videos on my website, but please reach out to me. Keep working on letting that belly out, ribs come down to free up your low back. It feels great when you don't have those muscles in your back pulling on your spine 24/7. Please reach out to me if you need it. I'd love to help you. Thanks for listening. Bye.